My name is Al Amalados and I'm the Deputy Medical Director for Medical Education for Sussex Partnership NHS Foundation Trust. And on behalf of the Trust, I would like to welcome you to your new posts that you will be taking up with us. By way of introduction, we are a large mental health organisation. We provide services in West Sussex, East Sussex and Brighton and Hove out of over 140 sites. We have about 100 junior doctors working with us, together with a similar number of consultants and associate specialists. Mental health is very important, regardless of which medical specialty you finish up in, because you will always come across people with psychiatric illness, and you need to be able to recognize that and at least have a discussion about how their problems can be managed.
Recently we expanded a lot the foundation posts in psychiatry because there is a national drive to have as much exposure to community posts and mental health posts for foundation doctors, because you can develop generic skills that are useful for any career, but also for foundation doctors to have experience of mental health. 1 in 5 of the population will develop mental health problems, so it will be almost impossible to do any career in medicine without coming across someone with a mental health problem.
My name's Dr. Patrick Lesev. I'm the locality tutor for Brighton and Hove. We cover a population of 250,000. We have Millview Hospital, which is where our inpatients and our crisis team are based, and the officers for the team are upstairs at the Millview Hospital. And then across the city we have 2 assessment and treatment services, one based at Hove Polyclinic, which is the clinical base for the West ATS, and the other is called East ATS, and that's based at what was Brighton General Hospital up by the Race Hill. That's otherwise known as East Brighton Community Mental Health Centre. And of course a lot of our patients, they access secondary mental health services over in A&E at the Royal Sussex County Hospital.
So I'm Nagam Darwood, I'm a GP ST2 and I'm currently working on Regency Ward at Millview Hospital. No 2 days are like another, they're all very, very varied, and that's one of the great things I've found about working in this job and working in this trust. So on Monday to Wednesday I'm based on the ward, and this is really interesting in itself. So during that time we'll do ward rounds with the consultants and the rest of the team. So we usually start off with a multidisciplinary team meeting, and the first thing that I was struck by when I started here was just how good the multidisciplinary team approach was, and everybody's opinions valued. And then after the multidisciplinary team meeting, so that's usually on a Monday, we'll see patients with the consultant in the ward round, and we can partake in that, so do the ward round or take notes from the ward round, and that's a fantastic learning experience in itself. I'm very lucky because on Thursdays I get to do a substance misuse clinic at the Pavilions Centre, which is really useful for a GP trainee, and on Friday mornings I do a community clinic. On Wednesday afternoons, and that's the whole afternoon, we have psychiatry departmental teaching. It's a really broad general week of fantastic learning and great opportunity, so to get lots of experience that's obviously going to be really useful for me as a GP.
My name's Alice. I'm a core psychiatry trainee, which means that I'm training to be a psychiatrist. I'm in my 3rd and final year of core training in psychiatry. Currently I'm working in something called the Assertive Outreach Team, which is working with patients with long-term mental health conditions. An average day would be kind of a team meeting in the morning, a bit of time doing some clinics, either by yourself or with some seniors, and then you might do some home visits. There's generally quite a varied amount of things that you'll do throughout that day, and it's quite a varied job. You may have the opportunity to run some clinics yourself. They'll be booked in independently for you, and then you always have the supervision of your consultant. So you might start by seeing patients with a consultant first and then move on to doing your own clinics, but always with them next door or at the end of the telephone for you to discuss.
I'm Fred Simon, I'm a F2 and I work in the psychiatry liaison department at the county. Monday morning I work in the county just seeing and assessing patients, and Monday afternoon I do the neurology ward round. So I go around one of the neurology consultants where we assess new referrals. Tuesday is all day at the county. Wednesday I have my morning off and then teaching in the afternoon here. Thursday it's all day at Brighton General Hospital in the neurobehavioural disorders clinic. And that's again seeing those patients with ADHD, autism spectrum disorders and Tourette's. And then Fridays again at the county.
The on-calls are a lot less frequent than a lot of the rotas that I've done before for other specialties, which I think is a good thing. But equally, I think there's enough experience there. So you either do a weekday or weekends. They tend to come in blocks, which is quite nice. So you get them done and then you have a period of normal working, which is fantastic. During the day, on a weekday, you'll be based on your ward and only get called out if, for whatever reason, there's no one else to cover the ward that has the issue. You'll be admitting new patients, so that forms the bulk of your work. So to admit new patients from the community, sometimes from police custody, and you'll be seeing them, clerking them, doing the assessment, and if necessary, you can always discuss them with a senior and discuss them with the nurses on the ward.
The on-calls run for a 12-hour shift, so you'll either be on a day shift from 9 o'clock in the morning till 9 o'clock at night, or you'll start at 9 at night and go throughout the night. When you're doing on-call, you're based here at the hospital and you cover this site here. You also cover the accident and emergency department. If there's no cover there, then you might be called there. So generally there might be a bit of travelling between sites. The on-calls themselves are very varied. I myself find them quite interesting. You see lots of different things, and actually outside of your clinic or your ward, it's a way of learning about psychiatry in general and learning kind of how to cope with emergency psychiatry and emergency situations. You also cover medical problems for patients on the ward, so that's quite GP based. You'll be seeing kind of minor ailments and treating those out of hours.
When you come to Brighton and Hove, you will be attached to a team, either an acute team or a community team. You will have team meetings for discussing patients in a multidisciplinary team with social workers and community psychiatric nurses and occupational therapists. And then also you will have your own teaching requirements. And in Brighton and Hove we have our academic programme on a Wednesday afternoon where there's the ability to do case presentations and such like, present articles from recent journals, looking at latest evidence.
Informally, you always have your consultant supervisor and they have a huge role to play in your kind of education as you go through. But more formally, we have every Wednesday afternoon is devoted to a specific teaching programme. That's protected teaching time, so you don't have to be on the ward or in clinic at that time. That's blocked out for you. Usually there's a case presentation where everyone's present, which is usually quite an interesting discussion. And then there's more specific sessions based upon what level you're at or what you're training in, where you'll go and have slightly more specific small group teaching, and that goes on for 4 hours. So it's a good amount of teaching, and we're lucky to get that much teaching, I think. Outside of that, if you're training in psychiatry like I am, every other Thursday you have what's called the MRC Psych course, which is a full day's teaching on various topics that's mapped exactly to your exams. So that's really helpful, and that's a kind of very positive thing about training here, I think.
You'll have clinical supervision from your educational or clinical supervisor, and that will happen during the week when you're working on the wards on a sort of an ad hoc sort of fashion. And as well as that, educational supervision, which is for a full-time trainee. It's a dedicated 1 hour per week at the same time each week, where not only can you bring career issues, educational issues, clinical issues, but also personal issues. Feedback also can be provided to the trainee at any time in educational supervision. Sometimes they'll get feedback from other members of the multidisciplinary team leaders, occupational therapists. And if you're a psychiatry trainee, of course, you'll be obtaining feedback from all multidisciplinary feedbacks as part of your training and for your portfolio. And the same happens for GP trainees, and I imagine for foundation trainees as well.
I think you're very well supported. So you get a very good induction, probably one of the best inductions I've had for any job, maybe ever, which is a good 3-day induction. And then when you start in the actual job, you're not really thrown in the deep end at all. You're given clear advice on what you're expected to do. Obviously your first on call is quite daunting, as mine was in psychiatry, and a completely new subject. But You're encouraged to talk to someone if you feel that you're out of your depth, or if you're unsure. You can always speak to the registrar on call, and if there's no registrar you can speak to the consultant, and the consultants are very nice and approachable. And equally you can seek the advice of the nursing staff, who are very experienced about certain things. So I think it's a good supportive environment, definitely.
It's very much teamwork, because you're on call but you're also there with a whole group of nurses and so on, so there's always someone around that you can ask if you're not sure. And then in terms of senior support, you've always got both a higher trainee, so as a registrar that you can call to speak to, and you've also got a consultant ahead of them as well, so there's always people for you to talk to for advice.
Generally, I found the rota here to be really well organised, and the rota coordinators are absolutely fantastic in terms of accommodating requests, and if you have specific needs or specific dates, so for example for weddings or for exams, it's worth letting them know in advance if you can, so before you start your rotation, so that they can help embed that into the rota.
My name's Edward Lepper. I work for the Mental Health Act department in Sussex Partnership. My role is the Practice Development Officer for Mental Health Law, which means I'm a trainer for people on the Mental Health Act and the Mental Capacity Act. For junior doctors, we're going to do a training session around their responsibilities under the Mental Health Act.
Every junior doctor from the beginning of their job will know what their work schedule is and what their worked hours should be. If at any time they work in excess of those hours, then what they should do is to enter what's called an exception report, saying when they worked over, how much longer they worked over, and what was happening at the time, and then submit that. That will go to their educational supervisor, and a copy of it will also go to me as the guardian of safe working hours.
Yeah, one aspect of working in Brighton and Hove would be the involvement in what is known as MERS, the Mental Health Rapid Response Service, a service based both at the Millview Hospital and in East Brighton Community Mental Health Service. And when you're on call, you will be able to work alongside very senior practitioners in doing assessments for patients in crisis and that are presenting acutely.
Psychiatry is incredibly useful for a GP trainee, because you're going to be seeing lots and lots of people with mental health problems, and I think it's done particularly well here, because although you get the experience in quite severe mental illness, so on the wards and how to manage that, you do get a flavour of community psychiatry even when you're based on a ward. The support here is fantastic. The way you're treated, I think this is an organisation that comes across to me as very patient-centred, and that filters down in the way that the staff are treated. So even when you're on call, the nurses are really supportive of you. I've been offered so many cups of tea when I'm on call, and I don't know how many times I've been offered cups of tea before. And equally, I think the facilities, so the fact that there's parking, we don't have to pay for our parking, the fact that there are showers if you choose to cycle in, things like that make you feel appreciated, and I think I've definitely felt appreciated and valued.
It's a great rotation here in Brighton and Hove. It's varied for all levels of training. There's a variety of experience that can be drawn upon. There's a lot of taster sessions for the foundation trainees. The GP trainees can get experience of both acute work and community work, something recently that we put into place. And just generally working in Brighton and Hove, you're going to see a whole demography of different conditions, which makes it a really fascinating place to work and, need I say, to live as well. It's a great city.
Psychiatry is the best kept secret in medicine. Your patient's the most interesting and you get to spend the most time with them. I decided I didn't want to do medicine, applied for a master's next year, and then did psychiatry, and then rediscovered why I liked it. So I'll apply for my psychiatry training when I finish my master's next year.
I do hope that your time with Sussex Partnership will be a profitable experience for you, and that you will learn as much as you possibly can in the 4 or 6 months that you are with us.